And now it is my pleasure to introduce our speakers for today. First, we have Dr. David Cooper is a digital health expert who is currently the executive director of Therapists in Tech, the largest organization of clinicians in digital mental health. He has worked with organizations like the U.S. Department of Defense, the AMA, the FDA, Teladoc, and many top hospitals in the U.S. on their digital health strategies and portfolios. He is joined by Dr. Vaile Wright, who is the Senior Director for the Office of Healthcare Innovation at the American Psychological Association. She is a licensed psychologist and researcher focusing on developing strategies to leverage technology and data to address issues within healthcare, including increasing access, measuring care, improving efficiencies, and optimizing treatment delivery at both the individual and system levels. Dr. Wright has maintained an active line of research with peer-reviewed articles in multiple journals. And as a spokesperson for APA, she has been interviewed by television, radio, print, and online media, including CNN, NBC News, the New York Times, the Washington Post, and NPR, on a range of topics, including stress, politics, discrimination, and harassment, COVID, serious mental illness, telehealth and technology, and access to mental health care. Dr. Wright received her Ph.D. in counseling psychology from the University of Illinois Urbana-Champaign and is licensed in the District of Columbia. It's not advancing for me. Thank you. And just in terms of disclosures, neither Dr. Cooper or Wright have any financial interest to disclose. And without further ado, I will turn things over to you.
Thank you so much, Gemma. Hi, everybody. Vaile and I are super happy to be here, talk with you guys about something that we work on a lot, but we recognize is a pretty, intense topic right now that a lot of folks are working through. And that's how do we ethically navigate this new world of digital health? Everything from telehealth apps, AI, etc. How do we deal with it? Make sure I've got control of the slides. Yes. All right, cool. So we got a wonderful intro, and of course Vaile sounds very much better than mine. She's got a lot more background than I do. Again, no conflict disclosure. Also, we don't speak for CDP, we don't speak for the APA. We speak for David and Vaile, and are bringing just our experience and knowledge to this. Just to give you a quick idea, here's kind of what we'll be going over today. Throughout, as we talk, please drop questions in the chat. We'll probably ask you to comment. We'll be doing some kind of, some ethical case studies and things. So really want this to be, as much as we're talking and telling you things, we want to hear from you as well, so that we can speak to your questions or your particular situations and really hear about how you all are thinking about this stuff on the front lines of care. Key learning objectives, right? We're going to go over that for everything. At the end of this, we want you to be able to understand those core ethical principles and apply them in the context of digital health, be able to analyze and mitigate your own ethical risks, develop your own frameworks for talking about these things, and really engage in collaborative problem solving with your peers. I think that's one thing you'll hear us talk a lot about today is, we really are going into kind of, I wouldn't say uncharted territory, but this is a lot of new stuff being thrown at you all. Thankfully, we've kind of handled a lot of these things before. We have robust ethical frameworks to work from, and you have peers that you can engage with to talk through a lot of these ethical dilemmas and issues that you might be facing. So let's start off by asking a question. Throw it in chat. Or you got a poll that's popped up. How comfortable are you using technology in your work? Do you use it regularly? New maybe DoD, EMR besides, but how do you feel comfortable using technology?
I love seeing all the answers come in.
Yeah, it's great. And it looks like we're getting a nice, pretty good curve here. Few folks not the biggest fans of technology, but that's fair. Hopefully, I can change your mind or at least make you feel a little more comfortable with it. Vail and I can by the end of this. But I like that a lot of you are, hey, I'm already using it. I'm feel pretty okay with it, but I want to get better, or I feel very comfortable. All you very comfortable people, we're going to make sure that you share your experiences and share things that you've learned. Right. Control and okay. Well, then let's jump right into, for those who are maybe less comfortable with technology, we'll give you some definitions and level setting, or at least maybe even for you all who are more comfortable with technology, we can develop some shared understanding of terminology and how we talk about things. I know that's something Vaile and I have talked a lot about with various folks from APA to a lot of different groups, is just what do we mean when we say, mental health technology or something like that? We're all good scientists, right? So we got to define your terms. Um, but why are we talking about this? Why now? Right. And again, I don't think I have to tell any of you who've probably experienced the rapid growth of digital mental health and technology in how we deliver care. I really like this graph because it really set it for me of just how much the COVID crisis accelerated telehealth, virtual visits, all of that stuff, particularly in behavioral health. I think this was one of the largest spikes I saw of anything in their report, going from, under 40% to over 70% of all visits in mental health being done over telehealth. So, really you're getting a lot thrown at you pretty quickly over the last couple of years. And quite frankly, a lot of stuff that none of us ever really went to school for, right? Like, I don't think, I mean, hands up if you had a dedicated telehealth class or experience in your training. Kudos to you, because that's probably pretty rare. Um,
Yeah, I was thinking about
another,
that. I was thinking about that too, Dave, because there's a comment about one of our attendees who took a pivot about 3 years ago and is now, really steeped in this work. And it made me think about how so many of us were not trained in this work and have had to do these rapid shifts as a result of, sort of COVID-19 and the way in which we are just practicing so differently now than we were before. But that we can pivot. And I think that that really speaks to our ability to use our training and adjust and to changing times.
yes, I think that is, if Vail and I leave you with any sort of sentiments from this, it's that you have the tools, you have the ability, you can do all of this. It is not as scary as it sounds. It is not as overwhelming as it sounds. I know there's a lot of doom and gloom and scare and fear about AI and everything coming at you, and it's really not that bad. I promise. We will make you feel comfortable with this, or I think, as we always used to say when I worked in the military, semper gumby, always flexible. And I think all of you can take that away. This is another thing I wanted to show you all, of just this survey of how different generations are using digital health, right? And, we think of this as, oh, not many people use this, or maybe we're not used to using this. The thing that really stands out for me in this graphic, and maybe not to date or myself or scary of our participants, is just the shift that happens right at Gen X. And as a reminder, that's 45 to 60 years old, right? That's not, what we tend, I know. Yeah. It's like one of those things of like, oh yeah, I am like up to 60 is Gen X. But really that shift in generations is changing, where people are using more virtual care. They're using more things to track their health and, assess their health. They're also, less engaged with their providers. I kind of have to wonder, is part of that the reception they get sometimes to how providers treat a lot of this digital information. I've had that experience of like bringing in my sleep data and my provider going, I don't know, what do I do with this? I don't know how to use this. So I think being comfortable with technology is not only something that's a professional benefit, I think it is something that is helpful to our patients who want to engage this way and are engaging this way. I think it's also important to look at it by the number of companies and the number of solutions that are out there. I grabbed this graphic as just the top 100 mental health startups. A, I know companies that aren't on this list, and B, I don't even know all the companies on this list or haven't heard of them. Like just to give you kind of a scope of how much, all of these things are engaging and the money and attention and effort that everyone is putting behind technology in mental health. Uh, so, give you kind of that scope of, yeah, there's a lot. And again, I don't think this is something that is going to reverse anytime soon, given all of this. So, I think that really means that ethics matter now more than ever, right? We've had that accelerated adoption. We're using it more. We have reduced sort of regulatory barriers, things with, were relaxed during COVID-19. A lot of companies got a lot of cheap money to stand up solutions. You saw all these companies pouring all kinds of money into technology solutions. And again, I think the thing I like to remind folks that really cement our place as clinicians in this is whether we are working at a clinic, whether we are working for one of these companies, whether we are out on our own, the reminder that MBAs don't take ethical oaths. We do, right? Like we have to use our ethical oaths. It's our reputation, it's our licensure on the line as we engage with these tools. So understanding how they work, how to ethically engage with them really becomes imperative for us as clinicians working out in the field, working with patients. We have to be able to advise our patients on what the risks are of the things they're using, just like we would medications or other things now. Technology is really standard part of practice.
And I think it underscores the real tension that I see in the marketplace. And Dave, you can tell me if you agree. Of, this on the one hand, these technology companies really need to, report to their investors, demonstrate that there's a return on investment, that they're making money. But there's a tension between that and sometimes providing quality behavioral health care. That most of us didn't go into this field to monetize mental health, and so I think there's sometimes some unrealistic expectations on the part of developers on what can they do in this space, and I think that's where the real ethical tension comes to the forefront, right? Because then what you see is these ethical breaches, whether it's privacy breaches or whether it's layoffs of clinical staff that put the public at risk. And so, I think these are real tensions that we as the providers then have to help navigate.
Yeah, I agree, Vaile. It's our role as, you get people who come in from maybe the startup environment or other kinds of business who maybe come in with really good intentions because they've personally been affected by something in healthcare or mental health, and they want to bring what they know and how they know how to work into helping solve. I mean, we all know there's a lot of issues and a lot of things we still need to solve in mental health, and I think we'll take all the help we can get, but it's not that one-to-one translation, right? Amazon does something. The worst thing that happens is fewer people buy pants, right? If they're messing around with data or stuff like that. If we screw up something, somebody forgets to take their medication, some data doesn't get transferred, that's a lot more serious. And so we need to help these people understand how they need to change and adapt their thinking into healthcare. Some quick definitions, again, just to kind of level set. Mental health technology, I think you can use that as any kind of tools or software that are really designed to support mental health. That could be apps, that could be online therapy platforms, wearable devices, virtual reality treatments, even maybe some AI. Like we're kind of taking the big bucket and lumping that into mental health technology. Artificial intelligence, right? We've heard a lot about that, but really, there's a lot of different ranges and aspects to artificial intelligence, but really, if you think about it as any kind of technology that can take data, recognize patterns, recommend decisions, or, output something based on those patterns. In mental health, it could analyze symptoms or predict risks, or even help us personalize treatment through Gen AI. All of these things really encompass sort of this broad umbrella of AI, like mental health technology. It's a big word that encompasses a lot. This is an important one. What is an app versus a platform? You probably hear that, you know, it's an important distinction, right? App, we're talking about like a specific tool, something maybe for like mood tracking, or if you're familiar with one of my apps, Breathe to Relax, a very simple kind of single purpose app. Or a platform is versus a platform, which is a larger system that it supports multiple functions or apps. Like an online therapy platform might include an app that does video calls, an app that provides messages, an app that does scheduling. They're kind of each individual thing wrapped up into a larger platform. Vaile, you want to talk about digital health and versus digital therapeutics? I know we've got another slide that helps break that down.
Sure. Yeah, maybe we can go to the next slide. I think that'll be easier. So I like this slide because I think one of the challenges in the space for everybody is the distinction between these different types of available technologies, and the lack, I think, still of really consistent agreed upon definitions. Even on the previous slide, there is no agreed upon definition of artificial intelligence. Everybody sort of has their own version of what they think it means, and that can be very, very broad or very narrow. But on this slide, when we're looking at digital health versus some of these others, digital health is really including technologies, platforms, these apps that David just mentioned, systems that engage consumers in lifestyle, wellness, skill building types of activities. As a result, they are generally in the direct-to-consumer or the business-to-business space. They don't usually require any clinical evidence to demonstrate that they work. So even though I get a lot of benefit out of my mindfulness app, there's a lot of mindfulness apps out there, and it's hard to tell which one is the good one versus which ones maybe aren't so good, because they don't have to demonstrate that to providers or to customers. And as a result, they don't meet the definition of a medical device or software as a medical device. So they don't require that oversight, that there's no regulatory body making sure that what they are creating is safe or effective or protects your data, to be quite frank. So that's sort of one bucket of technology tools. In the middle, you have what they're referring to here as digital medicine. So these might include some evidence-based softwares or hardware products that their goal is to intervene in the service of human health in some way. So they're not just trying to, say, teach you, again, mindfulness skills, but they're really trying to provide a higher level of service. So there is some requirement around clinical evidence, and there is some regulatory oversight. So you sort of have this middle class. They're classified as medical devices, require clearance or approval from the FDA. And they're a big bucket, right, when you talk about sort of this digital medicine space. Us at APA, where we've really focused a lot of our attention is under this right column, which is digital therapeutics. So digital therapeutics, they are apps. They look often very similar to the over-the-counter direct-to-consumer apps in the wellness space that you can get. But you can't usually access them without the assistance of a provider. And that's because they provide an evidence-based, clinically validated treatment. In the case of mental health, for example, it could be a digital CBT for insomnia treatment program, right? So it's not just a sleep diary to help you, track your sleep, like David mentioned earlier. What it really is, it's delivering CBTI in a personalized fashion over a several week, usually something around 8 to 12 kind of weekly intervention basis. Again, because these do fall under the category of software as a medical device, they are regulated, which means they have to demonstrate at least a low bar of safety and effectiveness, depending on what they're offering. And so again, I think that these could really be a potential game changer in the space in terms of increasing access to care, improving outcomes, and improving efficiency in care. Because while everybody deserves to receive traditional psychotherapy, that's weekly, telehealth or in-person 45-minute sessions, that's not necessarily what everybody needs or what everybody wants. So I really think about this space as providing new opportunities, not to replace providers by any means, but to really meet people where they're at and figuring out what is it that those who may never walk through our door need, and what are the tools that for those who do walk through our door that we can help them reduce their suffering faster. So that's where I get excited about this space. And I think all of these can play a role in, I think that improving population health outcome that we all care about. But for us at APA, we really do focus a lot on this right column because we see that as having some of the biggest impact. Not to say that there aren't challenges to scalability. Sure, if you're interested in that, you can come to my keynote on Thursday, where I think I talk about that a little bit more. But I think these are just sort of, again, giving a sense of level setting of what's happening in the space.
No, I love that. And I love the idea, we talk a lot about like measuring from the floor rather than the ceiling, right? What is the, if the alternative is nothing, let's give them something, right? I wonder, Vaile, could you maybe give some folks examples of apps or things that might fit in each of these categories to keep an eye out on so that they are like, have a mental benchmark?
Sure. So I think in the digital health space to the right, some of the most common things you might see are apps like Calm or Headspace, Noom, Woebot before it now will be sunset by the end of next month, was sort of your quintessential chatbot that most people refer to in
Yeah.
the space. Um,
Fitbits, right? Like that would be
mhm,
digital health, things like that, right?
sure. Um, in the digital medicine section, um, I think sometimes you see wearables in this space, right? Depending on what the wearable is. Um, VR headsets might fit in the space. What
Yeah.
other things are you thinking of, David?
I think for me, it's a lot of things that include physical biomarkers. Like if you are, let's say you have a manic patient and you're tracking their sleep through Fitbit, like that could fall into some of this area, right? Where you're making a clinical decision based on data gathered by a particular app. A lot more times you'll see them in hospital settings where, you may have like something monitoring vitals for the entire floor, that people have to react to, and that can fall in that digital medicine category. How about digital therapeutics, Vail?
So I think, some of the most commonly known kind of cleared by FDA products in the mental health space include Daylight, which is digital therapeutic for anxiety, generalized anxiety disorder, Sleepio, which is for insomnia, um, Rejoin, which is for depression. One of the ones we're kind of excited about that hasn't quite been commercialized yet, but it's called Mama Lift Plus. It's for maternal postpartum depression. So I think what you're seeing initially in the space, and they can also include some digital therapeutics that are diagnostic tools, like Cognoa has a product for diagnosing autism spectrum disorder. So there's a variety. I think I think you're going to see increasing numbers in this space as we continue to move further away from the public health emergency and continue to identify ways to reimburse within this area.
Yeah. Um, So let's talk. I mean, right, we have probably a broad variety of folks here, whether we're talking, regardless of which APA we're talking about, or social work, or American Medical Association, American Telemedical Association. A lot of different folks have their own ethical frameworks that we agree to when we get licensed, right? And so I think that's knowing your own framework, knowing the frameworks that you operate under is sort of key because they do all share a lot of the same core principles, right? Um, do good, avoid causing harm, protect people's well-being. let people make their own decisions, right? When it comes to technology, that means I want to use technology or I don't want to use technology. Both of them, allow for that respect for autonomy, making sure we don't discriminate or give unfair advantage to anybody. Um, Being honest or transparent with patients about, hey, this is how it works, this is what I know, this is what I don't know, this is how this kind of thing works, or things maybe you need to think about it when it comes to your own rights and your own medical care. All of these things are things that we deal with in a lot of other areas, and really cross-cutting principles, regardless of the specific ethical framework that we're sort of discussing. So what we're really, and again, if you take one thing away from today, that's really it. It's that you have the tools that you need in order to navigate these new solutions, new innovations when it comes to how do I approach them ethically and make sure I'm doing right by myself and right by my patient, right? There's always continuity and change in how we deliver care and how the ethics are applied. Every day we come up with some kind of new ethical boundary or new ethical question. We're always trying to take these traditional principles and interpret them in these new ways. And especially for innovation, there's always going to be a lag behind what we do as good practice, as good ethical practice, and where the technology is. Personal story of mine is when I joined the DoD, as a civilian back in 2012. I was like, oh, I'm going to research apps. Apps have been around for a while. I'm going to look at the research and how do we do this ethically. And there was nothing. There was no research on there on apps. It was all the research I could find was like texting interventions from like 2000, 2001. I'm like, I felt, a decade behind already, and we are just getting started. So I had to do a lot of my own kind of reasoning, talking with folks of like, okay, how do we do this ethically? How do we make sure we're researching this and conducting this in ethical ways, given that there was no, real discussion around it? Um, a really good example and a good paper that I'd recommend to all of you. A good example of this and a good paper I'd recommend is Cheneville et al. Talking about ethical considerations around AI. And the reason I like it is they do a really good crosswalk and show you that, hey, here's the general principle, here's a question to think about. And so kind of scanning through that and asking yourself your own questions, it gives you that ability to start to develop that ethical framework, your own ethical framework of how you apply these to the setting of care that you're conducting, the tools that you're using, the teams that you're working with, and how do you handle these with your patients. It's, a good thing. Maybe you could do a didactic on after this, take this back to your own team and talk about this paper and talk about some of these things as a group of how do we all think about this and how do we all kind of crosswalk this in our own mind. Vaile, I know you. I'm going to I'll let you talk the draft ethics code for APA since that's one of your things.
Sure. So yeah, I agree. I think that paper that you just showed on the previous slide is really interesting. And part of what makes it very interesting is that this code is going to change. And in fact, it's drastically going to change. So this references the APA ethics code from 2017. So we haven't had a revision since then. But it is currently being revised. It's been about several years that the revision has been taking place. The initial draft of the new ethics code was put out for public comment just this past December. It was out for about a 90-day public comment period, which is part of our APA internal policy when it comes to standards and new documents like this. The drafters have received over 2,000 comments in just that 90-day period. I think it's even higher than, I think it's above 2,500 comments. And truly, they will go through every single one of those comments and address them. Now, I'm not sure how many of those comments are duplicates, so sometimes that happens as well. But what I would anticipate seeing 2,000 plus comments is that there will probably be a revised draft that then goes back out for public comment again. So if this is an area that you're really interested in and or have some expertise and wasn't aware that this process was happening, I really do hope that that you provide some feedback of your own, because these standards are critical to the field of mental and behavioral health. Even if you're not a psychologist, many states' licensing boards adopt these ethics codes as part of their requirements. And so what I think is really interesting with this revision is that there's a brand new section on technology. It includes 25 new statements on how providers can maintain, an ethical lens when it comes to technology. It has a variety of different sections, including technology competencies, the use of technologies, confidentiality, privacy, and use of technology, security, transmission, and disposal of electronic data, as well as a section on social media and online platforms. So you can see I sort of just cherry-picked 4 out of the 25 comments or statements that they have, in part because I do think it's really interesting to think about how would you as a provider really operationalize some of these ideas. And on top of that, how would you demonstrate to a licensing board that you were adherent, that you were able to adhere to the responsibility for the content, including findings, recommendations, and evaluative statements of artificial intelligence in your work? And I think part of the feedback that we provided to the developers was around this sense of where does the responsibility lie when it comes to ethical care? What part is the provider responsible to be able to demonstrate versus what's the responsibility of the technologist to be able to ensure that materials created by AI are scientifically accurate, right? And what happens when an AI tool is incorporated into a system that you're part of without your knowledge? And we're going to talk a little bit about that. Or what about autonomous AI and what's our role there? I think one of the other things that we will talk about, I believe, as we continue, is this need for ongoing training as well. That as with any ethics, it's not a one and done. I figured it out. I'm ethical now. But really, ongoing training is necessary in this new world and new space. So again, I think that a lot of different organizations and groups are trying to wrestle with what does it mean to be ethically and safe when we're incorporating AI and other emerging technologies into the work that we do. And so it's part of why I'm so excited about having this conversation here.
Thank you. That's great. And again, this is just American Psychological Association, and I encourage you, if you work with NASW or some of these other groups, to ask them what they're doing about AI and help take the lead so that they can be engaged on this issue. It's, we're all in this together of trying to figure all of this out and support each other. I want to take a second and ask, catch up on some questions in the chat, but while I'm doing that, I want to pose out a question to some of you all. When it comes to sort of these ethical issues, what elements are maybe most worrying to you that we can address today? Or what are you not worried about at all, conversely? Like, that would be interesting to hear. I think looking back at the chat, it looks like, I agree that, we do need more, approved platforms for a lot of this stuff. Thankfully, it sounds like DHA and DoD are working on that with MHS Genesis. That's great. When I worked at the DoD, we could barely spell API. So I'm glad the technology seems to be catching up with a lot of that. A lot of issues on, yes, HIPAA and laws and things tend to lag behind. I don't think that's necessarily a bad thing. I don't want our government necessarily taking a lot of risks, but yeah, I think it is about time that we update a lot of this stuff. And even just like some of the differences as things change over time. I think, going back to that graphic where it talked about Gen Z and millennials and things like that, I think you've seen a lot of trends of people feeling more comfortable. I think it's really two trends, right? People are more comfortable using technology and data, and people are really sort of maybe less trustful of establishments and authority. I always like to say when it comes to technology, technology is anything that was invented after you were born, right? The quote from Alan Kay, right? We don't think about it, but maybe the horse and buggy at one point in time was the height of technology, but we don't think about it that way. And so having to kind of shift our mindset of these things are new to us and we may think about it as high tech and things, but for a lot of people, that's just how life is and how they interact. Um, let's see, worried about misuse of data and illegal access to data. Looking at some of the things coming in, I think that's very true, right? That's very, again, especially if we are professionally liable for any kind of data breaches or we want to make sure our patients are safe. And I think that's certainly much more important when we talk with patients who are using some of these publicly available tools and educating them on, who is a covered entity and how do they, who is covered by HIPAA and who is not. Just because you're a digital health tool doesn't necessarily mean you're automatically covered by HIPAA, right? Um, let's see. Figuring out, okay, I'm glad that we're good on virtual care, telehealth. Maybe that part will go quickly. We seem to be doing good there. Um, and I really agree with Catrice, right? Like getting in with AI is important, right? If we don't use these tools, if we don't understand how these tools work, we're not going to have a seat at the table when it comes to updating them and helping people understand how to use them ethically and responsibly. Let's see, privacy. Um, okay. Let's see. Over reliance. Yeah, go ahead, Vaile.
Now, I just wanted to underscore a point that was mentioned earlier is I do think one of the challenges to ethical scalability and utilization is that these emerging technologies just so far outpace both the research, right? Because we have research methodology, reimbursement pathways, regulatory oversight, and privacy policies that were not developed for emerging technologies, right? None of these were. And so it becomes really challenging. We have to, I think, rethink all these structures that we have in place in order to really, I think, feel more comfortable with the emerging technology that's happening and ensuring that what is being developed is safe and effective, responsible, and good, and so I do think that it's not, we can't just keep doing things the way that we've always been doing them. We have to rethink some of these traditional structures that we've put into place. What could emerging research look like that would be more at pace with these technologies so that providers would feel more comfortable using them effectively? And I think so. I think there's a lot of different systemic things that have to happen. It's not just you as a provider also getting comfortable, although that is an important part of it.
Yeah. Um, catching up on the chat, I think some people are concerned about maybe over reliance on AI. I agree. I've been there before where you have that sort of crisis of am I using this too much? How am I using this in the right way? And I don't think anybody has figured out maybe how to use it in the right way. I think we're still kind of experimenting with it. I know I am in kind of my own writing and how I use it day to day. I know I still tend to remain optimistic. Maybe I probably wouldn't be doing technology if I wasn't optimistic. Um, I am hopeful that with the right people at the table, the right people thinking about this in the right way, it can become a tool that helps us improve practice and be better clinicians rather than anything that replaces us, right? Um, when I talk with companies, I tend to say, like, let's start with automating the stuff that's not why we're here. That's not the clinical work. We all have stuff that we do on a day-to-day basis, forms, all kinds of things that we have to do as part of regular practice that's not directly helping patients, but maybe part of the thing that makes everything run. I'm sure we'd all like to do less of that. How do we um, become better clinicians? How could we use AI to maybe give us feedback on how we're conducting therapy and give us things to reflect on? Um, there are companies that will analyze your sessions. Say you talk this much, patient talk this much. Here are kind of the emotional words used. I've seen it where you can like query your notes after you come back from a break. Patient was talking about this. Remind me where we are. I think there's a lot of different use cases when we talk about, especially AI and a lot of these other things that we're still figuring out, but I tend to remain hopeful that will help us change how we do practice in a way that allow us to be better clinicians. Um, all right, Vaile, anything else to add on any of that? Any of the questions and feedback?
No, I think the only other thing I would add, because I hear this a lot when I'm doing these talks, is just reminding everybody that none of these are a replacement for our clinical judgment, right?
Right.
That no matter what you're using or if you're using it or when you're using it, your clinical judgment always has to be the first thing at the forefront, in my opinion.
Absolutely. Again, it is your clinical judgment, your license, your reputation, all this stuff on the line. So you should use tools in the way that you're comfortable using them, and you should speak out when things make you feel uncomfortable about how you're being asked to practice. I think now we'll start going into specific areas where a lot of these ethical concerns can come up. It sounds like from a lot of you, you're already doing a lot of this in teletherapy, so this may be refresher for a lot of you, but I'd love to hear kind of as we go through it, what issues have come up for you that maybe we're not going to touch on, things that you've actually experienced or navigated through this. Again, in these kind of things, it's always good to pull in real world examples and talk about them. So, all right. Teletherapy, right? Thanks COVID, we're all familiar with virtual care and teletherapy. I think somebody mentioned they went from 0 to 100%, telehealth appointments like overnight, basically. So teletherapy, right, is when we're doing it over the phone, over video. There's a lot of over, even chat and SMS. There's some platforms that allow you to do messaging. All of those things can sort of fall under sort of what we think about as teletherapy. A lot of platforms you're going to have are things like Zoom, DoxyMe, VC. It sounds like there are specialty things with MHS Genesis where you can connect through a video appointment, or things in the military and VA community have their own platforms. And of course, it wouldn't be, this presentation. Thanks, Vaile, for dropping that in the chat. APA, of course, has their own telepsychology guidelines. You want to say a little bit more about those?
Sure. I think lots of different organizations have telepsychology guidelines that I think for us as providers can be helpful to keep abreast of, whether that's ATA or, master's level and social work associations. We recently revised our telepsychology guidelines because, as you can imagine, when they're originally developed 10, 11 years ago, a lot has changed in the space. And so I just drop it in the chat as just another resource. Particularly I think those who are training future providers, I think this is the kind of document that often students find helpful. In particular, some of the new areas that were added were around a section on supervision, as well as an expanded section around interjurisdictional practice, because we've also seen working across states as obviously also increasing quite a bit, whether it's a psychology compact or some of these other compacts that are being developed across different behavioral health providers. So just again, drop it in as a resource. Oh, and thank you for dropping in the social workers one as well. That's great.
Yeah, and if there are specialty ones for DoD or VA or CDP, Jenna, if you have any other things that you'd want to, resources like that you'd want to put, we definitely would welcome those as well. Again, probably things you've heard before, but we have to think about, specialty considerations when it comes to practicing ethically in some of these virtual spaces. Privacy and confidentiality, right? Who is, you probably have this conversation with folks. Who else is in the room with you? Can anybody hear you? I remember one of my fellow clinicians doing a telehealth appointment over phone call with a patient. And they had it in their Bluetooth in their car. And I mean, that's so loud, other people could probably hear it outside the car, right? I know I've had that experience, right? You're walking by. So, hey, maybe, don't use your Bluetooth and make sure your volume's at a reasonable level so that nobody else can hear you if you don't want anybody overhearing these things. Informed consent, right? Do you want to do a telehealth appointment? Is that what you're interested in? Making sure you know what you're getting into. Boundary issues, again, going back to, people could overhear you, right? It's not you and me in a room that I know the space and I've taken care to make sure that we're not going to be overheard. So if you are walking around the park or, wherever you're taking this telehealth appointment, do you have that conversation with patients about making sure that they're aware of the risks? And competence and training. I say this because it applies to really all of technology, but again, during the pandemic, it seemed like I used to keep a running track of all the various video platforms I was using. I think I had a list of about 10, most of which probably even aren't around anymore. Blue Jeans, anyone remember Blue Jeans, or WebEx and a lot of these things, right? So it's constantly like, where's the mute button? Where's all this stuff? How do I work any of this stuff? How do I go into MHS Genesis and find that virtual appointment and start that? How do I make sure the patient on the other end knows how to receive that and start the appointment? Do I sound good? Do I look good? Is my lighting good? Am I coming across professionally and responsibly in a way that will benefit my patient? Do they sound good? All of these kind of things, is important, right? It's such a audio visual medium. We're trying to replicate that in-person environment. So getting that as close as we can and how we look and sound is one of those specialty considerations for telehealth. Privacy and confidentiality, right? We had some of those COVID era relaxations. Vaile, do you want to talk a little bit? I know they're set to expire in December, but or September of this year, 2025. But I don't know if you want to say anything more about how APA has navigated those or talked about them.
Certainly we've provided a variety of different resources. To somebody's point earlier, I mean, I think there do need to be updates to HIPAA. And we've tried to work with whoever's whatever administration's in office to try to come up with appropriate new guardrails and parameters that are not too onerous for providers to be able to meet as well. I think we'll see if it really expires or not at the end of September. I think there's a lot that's up in the air. Things continually get pushed back. Continuing resolutions occur and then occur again. So it's a little challenging to predict anything that's happening right now if it relates to the federal government. So, but I can say we are certainly tracking to the extent that we can across all these issues.
Try to keep everybody informed. I'm curious, drop in the chat. Are you all getting training on some of this as where the tools are, how to use them? Are you getting any sort of guidance and how to set up your office and physical environments to conduct telehealth? Okay, nope. All right. Nope, that's good. Perfect. Thank you. It's I see that coming in. I don't know. Let's talk a little bit about that, right? I'm glad in the VA. So regardless of any specific tool, I think there are things that work across sort of telehealth platforms, making sure that you have a camera that looks nice and isn't necessarily pointed up your nose, right? Like I think some laptops, the camera's like down here and you have this weird, kind of thing. Making sure you're not backlit, right? Making sure the light's in front of you, whether that's by sitting by a window or having maybe a light source or things like that. Making sure you have a microphone that sounds good and can be heard well. I know when I was setting up my environment, I watched a lot of videos on people streaming and things like that. Like, how do they set up? What equipment do they use? I'm like, I watch videos on YouTube. People look good and sound good. How are they doing that? is a great, some of those are great. I'm a big avid fan of YouTube University for learning a lot of these new skills that maybe aren't necessarily directly related to care or work around technology. Making sure that you can't be overheard, right? Like having that same white noise machine that you work, with patients if you're using your speakers, or maybe having earplugs in, right? Like common thing is a lot of headphones will have like you have like one earbud in so that the speaker only you can hear kind of what's coming out. Let's see. Anything else I'm missing, Vaile, that kind of comes to mind or is obvious about setting up your environment for telehealth?
No, I think those are most of the things that I think about.
Okay. And again, we talked a little bit about it, but on the patient side, making sure, again, is there anybody in the car with them if they're taking from a car, if they're walking through a park, making sure they go find a secluded space and they feel comfortable talking about personal issues wherever they are. Helping kind of prep them. Some people are going to be more comfortable with it, some people not, and maybe need that reminder. Even if they're taking it from their house or their office, are they in a place where they can be overheard? Are they in a place where they can be seen? Um, where are they calling from in case of emergency? That's a great example, Randall, of like discussing with patients of like, hey, so where are you taking this call right now? And maybe that's how you can start some of these conversations of, okay, just making sure, um, you know, how to kind of address some of these things. Documentation and record keeping. Some video platforms allow you to record sessions, so knowing if that an option, is that something you want to discuss with your patient? Or, we'll get into it with like AI note takers and some of those things, letting them know, hey, this is what's happening on my end, what's happening on your end. Let's talk it through. Great. Now that we're all informed, we can kind of go forward with that. Um, Informed consent. We talked about that, the sort of the unique elements, making sure you're writing that down in your notes. Hey, discussed with the patient, the issues of teletherapy. They were located at blah 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 when they took this appointment, and then ongoing, making sure that's an ongoing conversation with the patient. Hey, is this still working for you? Do you have a place that still meets all these requirements? It needs to sort of that element of that informed consent, that again we would bring up with a patient in practice, needs to continually happen with teletherapy as throughout the course of care.
But I do think it's
Um,
a little different than how we thought about it before virtual care, right? I mean, you might do
yeah,
informed consent about, this is the office and this is my expectation for showing up on time, and here's what happens if you miss an appointment. And, but you often don't revisit some of those types of things. But I think when you're
yeah,
doing telehealth, you actually really do. It's not just checking in about how they're doing, in terms of the relationship, or do they feel like you're being heard or their goals being met. But this is really an additional piece of saying, look, this is a different way of administrating treatment. Is it still working for you? And I think often we just take for granted that they agreed to it at the beginning, and so we just assume that it's continuing to meet their needs. But I do think, because we wouldn't ask somebody in face-to-face and brick and mortar settings, is this brick and mortar setting still working for you? Right? Like we wouldn't have that conversation. So I do think it's an important piece of thinking
yeah.
about what does informed consent look like?
Especially because I think, again, to that point, Vaile, when we're doing teletherapy, it, I think there's something to it that it can become almost a normalized behavior, considering how many of us are maybe on Zoom or a lot of these meetings during the day or take calls throughout the day. You get in a mindset of, well, this is like that, right? And so like reminding patients like, nope, a little different. We're talking about different things. This isn't, are you up to date on your timesheets, or calling your mom to check in for Mother's Day, which is coming up soon as of this recording. Reminder, everybody. Um, Right. Like, but reminding everybody, like, oh, hey, remember, this is a little bit different so that you help them not fall into that mindset shift of, well, this is just like the other things I do with this device, or this is the other things I do with that, because there can be that bleed over effect when we're doing it in a physical location, a physical clinic. Often there is that kind of separation or that like audio visual cue of now I'm going into doing something different. I'm entering into a new space. Whereas this is much more diffuse boundary when it comes to that sort of space. Um, Speaking of which, there are boundary issues, right? Time boundaries when the office is everywhere. Um, I think that goes for patients, but for you as well, right? Like, what are your time boundaries? It becomes a lot easier to see patients after hours or on the weekends. And are you okay with that or are you not? Right? Like, that needs to become something that you think about. Um, when are you accessible? When are you not? It becomes that discussion. Um, all those kinds of things. Having that input and having that discussion not only with yourself but with patients is important. Again, I know there are some things like DBT where you expect to be reachable all the time, but again, people say, again, are you cool with patients texting you? Are you cool with patients texting you after hours? How are you going to handle any kind of emergency things? Self-disclosure through virtual environments. Again, you have to think about like what are you presenting, what's behind you when you talk with a patient. Are you cool if your kid runs through the background or a pet jumps up and says something, or thinking about these things that can happen when you're again not in a space that's not the office, but maybe again you're in your own personal space. And likewise for patients, what happens if you see something in the background, and what do you have to do about that? Not just for emergency situations, which we talked about, where are you, who's there, those kind of things, but making sure that the patients don't inadvertently disclose something to you. Navigating those multiple roles and relationships. Again, we all work, if you're doing virtual care, you are working out of your house, right? Like you are a parent, you are, a caregiver, you are a partner. All of these things can impact how you do care. On the break, I talked to my partner. She's like, "Do you need anything? You can how is everything going down there?" She's just upstairs, right? As I'm giving this talk right now. Um, so discussing that not only with yourself, with your partner, um, with your patient, right? If a disclosure does happen, all of those sorts of things are what you need to think about when you're thinking about boundaries. So let's talk some practical examples. Oh, sorry, Vaile, were you gonna say something before I
No,
jump
I think
off?
I was just going to say, particularly with the boundary issue, I think that can be one where people get very nervous, right? Particularly depending on
Right.
how you were trained and what sort of your orientation is, and you're thinking about like the frame. But, I think my takeaway from that slide is that there aren't any hard and fast rules on this. It's not like there's a right way to, do self-disclosure and a wrong way necessarily. Exactly. I mean, because you can, that there isn't a benefit to it, right? That there's only sort of concern. Because you can learn a lot from a patient by seeing some of their physical environment, right? And so where do you sort of draw that line between where is it beneficial? And similarly, there could be some benefit in them seeing you in a more relaxed environment as well, and seeing you as human as a provider. So I just want to underscore that it's not like that there's not just bad aspects to these, that there are beneficial aspects as well. If that makes sense.
No, 100%. And I was going to tag on another bad aspect, but no, it's much more, much more beneficial to talk about like the positive aspects of this. Again, seeing people in more comfortable environments. Um, Again, it comes down to, is the patient more comfortable? And if they are more comfortable, are they going to be likely to be more attentive and more likely to be more focused in therapy? I will say one thing that has come up in the past with some of these is also getting a little diffuse with the boundaries, right? Like you think it would be common sense. Don't take the call from the toilet. Maybe put on pants before having a therapy point. You think you wouldn't have to say these things, but it has come up before, right? And what happens if somebody does something inappropriate, like not only security, um, for themselves, but security for you as well. What happens when they do something inappropriate on session? What is the clinic policy about ending session? How are you going to handle that? All of those things. Competence and training. I know there are a lot. Just don't go through the drive-through while in session. I don't want patients knowing my Wendy's order. Uh, Competence and training. I sure Jenna can tell you more about the offerings that CDP has on trainings and educations, ones like this. I know DoD and VA both offer trainings. Sadly, I don't know if they're collected in one place or you have to seek them out, but I know those trainings exist. Your state association should be providing you training, CE training on telehealth. There's some requirements about those kind of things. Making sure you are doing your own adaptation for how you deliver care in virtual settings. And supervision considerations, right? If it is recording, are those recordings things that you feel comfortable bringing up with your supervisor, right? Like that's, I think, to underscore what Vaile said, I think that's a place where technology can be more interesting. I mean, how many of us got the benefit of doing recorded sessions when we were in graduate school for supervision? Well, now we can bring up tricky cases and we can replay it with our supervisors to be like, here's how I handled it. How would you handle this situation? You can see this situation exactly how it played out, where we couldn't do that with maybe normal face-to-face sessions. So again, it's not all bad. There are aspects of this that can make us better clinicians. So then let's talk about two case studies, and I'm going to be curious what folks think about these in chat. So let's look at the first one. You provide teletherapy from your home using a secure video platform. You're working with a client and they're talking about a traumatic event, and you hear a faint chime, like if you said the A word or the G word or the S word. I won't say them in case anyone has those listening nearby and would activate now. This It indicates it was listening. So what do you do in that situation if you think you were inadvertently overheard by maybe a phone or one of the tools and devices that we have now? What are the things that you would think about? What are things that you would consider? Please drop them in chat and we can discuss them.
As we're waiting for people's responses, I think that there's a really funny timing for this question, because I think on the last slide, I heard my smart speaker in my living room ding after hearing you say something. So this is very true. Like this is a real scenario. I think that could happen, and of course, I hear a lot of people sort of just leave their smartphones on during sessions, and not really recognizing that they could also be listening in on the discussion that you're having.
And a lot of people, probably not a consideration I think a lot of people have even had looking from the chat. So I think, if you're in if you're in clinic, you probably don't have to worry about that. I know it was tough even getting a Wi-Fi reception in some of the military clinics I worked in. So don't think you necessarily have to worry about a smart speaker on your side in the clinic, but if it's on the client side, right? So I think you have to think about, what device was it, right? Where did it ding? Where are the settings for that device stored that I could maybe go in and erase what was said? Maybe make sure that you turn it off and put a reminder for yourself. Maybe you have like a little to-do checklist before a virtual appointment if it's yourself, or handing out a client. Like, I've seen that in the past. Like, hey, before a telehealth appointment, make sure, you're in a place that you feel comfortable talking. You don't have anything turned on. I think, where is that data stored? Who could be listening to it? How do I get access to that? What was said? How do you prevent it going forward? Talking it through with the patient. Some folks are talking about that, validating their feelings and making sure to bring it up. Like, oh, yep, that is a thing that we now have to navigate and deal with. And inadvertent disclosure, it happens, right? It happens in a lot of different settings. So how do we talk about, inadvertent disclosure? Whose side was it on? Where did it come in through? Um, Set those, address it immediately and set those boundaries and expectations. All good examples of folks coming in through chat.
And thankfully, we didn't see anybody say just ignore it.
Just ignore it and start just making sure you have a really cool playlist that comes up when somebody accidentally triggers it. Okay, good discussion. Let's look at the next one, right? After a particularly emotional session, client messages their therapist on Instagram, right? If we're in private practice, marketing ourselves, having websites, having email, being more visible is kind of a necessary thing. But if you get this DM on a social platform asking if they could talk later because they don't feel safe, even though you outlined your communication and boundaries and consent, they were able to find you, or maybe they found your personal Instagram, right, and then contacted you through that rather than a professional one. What kind of things would you think about that? Does that change how you think about things? Or has this happened with anyone? Have patients found your personal information online, Facebook, Instagram? How have you navigated that?
We have a couple comments in the chat. One from Amy, who says, don't contact back through Insta, but rather an appropriate form of contact, phone, virtual session, chat, if available.
Also, make sure your personal stuff is private. I think too, it's talking it through with the patient, right? Kenyatta brings up a great example. Talking about it in the next session and limit setting, like, hey, this is cool, this is not cool. Especially if you have, younger people who are maybe more used to using that technology as a form of communication. And again, don't necessarily think anything of it, right? They don't necessarily, it's just like they would contact a friend or a number of things that they do all day. We can all get into a habit of technology of using it mindlessly and not necessarily thinking about it and just using it in the way that we normally do. So reiterating requests, and talking about how those things work, setting those boundaries at that next session, talking about limit setting. This is what we do this is how we do things. We do this here. We don't do this here. All of those things. Having a policy that you hand out to patients beforehand. We don't connect on social. Like, these are the only things that happen, right? And I see a lot of folks in chat talking about these kind of things, which is great. And I'm glad you guys are all engaging in this stuff of setting those expectations up front so that you can, I told you, and I'm going to refer back to what we talked about at the beginning. It's not just sort of an arbitrary thing.
But I think, there are some, obviously having something in your informed consent is critical, because then you can always, if you have a social media policy, if you don't, you probably really should. There are examples of them all over, and I'd certainly encourage, but I think there are so many different types of social media platforms now as well that people can find you on. Like somebody mentioned Venmo. How often do you keep your Venmo stuff private? Or do you have a public setting? Because you have to actually opt into the privacy setting every time you give money, to somebody who, you shared ice cream with, or whatever the case may be, right? Is that sort of stuff you want your patients to know about? LinkedIn is another one where, you don't have a private LinkedIn account, because that's antithetical to the point of LinkedIn. It's to make these professional connections, right? But still people can find you there as well. So it's something that I think to think about in the space. Particularly if you use social media as part of your, patient education work. Do you also have a professional platforms, and what do you do? How do you navigate the two?
Yeah. And a good reminder, I think somebody dropped in chat, is you want to make sure that you are documenting all of these after they happen, right? So that you are saying, even if it's just a quick note to yourself, dropping that in the EHR the next day, having that official record of patient contacted me at such and such a time. They did X, Y, and Z. If you can send screenshots, right? Like, I think that's another helpful thing to say, to back it up, to say, hey, here's exactly what was said back and forth. I referred them to a more secure platform and ended communication, right? It doesn't have to be overly voluminous, but the more information you can provide, and even just putting in some sort of official documentation, is good. If only to kind of protect, yourself, and make sure that you documented the sort of ethical or concerning boundary breach there, for yourself and your patient.
Yeah, and Dave, what I think is interesting about these two case studies is, they both highlight what happens on an individual basis, right? If you're working with somebody and the ethical conflict or situation is, the sort of one-to-one, what happens in a therapy session, but what happens when the ethical conflict is actually at the system level, right? That whatever system you're working in is putting you in a position that maybe challenges your ethical guidelines or your code of conduct. This was something we talked about a lot when I was at St. Elizabeth's, because you had a lot of different providers. You had nurses and psychiatry and, physicians and social work. And while most codes have some alignment, they don't all exactly say the same thing. And what if the system itself is asking you to do something that feels, that goes against your ethical principles? I'm thinking right now about the recent policy requiring federal workers to return to work. And in a lot of situations across different VAs, mental health providers were hired as telehealth providers. And there's, what happens when you try to bring all these individuals back into, buildings that aren't built to house everybody, and compromises your ability to maintain privacy and confidentiality with your patient. And so what is your responsibility as the provider? How do you navigate system expectations or changes within federal policy, and your ethical responsibility to work with this patient and provide for them. So I think ethical quandaries happen in a variety of different ways, and we'll talk a little bit about what are the frameworks that you use personally to help navigate some of these challenges.
And I think not only discussing the issues amongst yourself, but also passing it up the chain, right? Making people aware, like, hey, if you bring us all back in, there's not enough places for us to sit. And then, this is going to inadvertently disclose patient privacy, and making sure that people are all aware of the implications of their decisions is important as well. All right, let's move on to everyone's probably favorite topic of this hot button topic, artificial intelligence.
There's already been a lot in the chat, which I'm sure.
I know. It's great. I love it. Hot button issue. So let's talk a little bit about maybe just a quick general overview of AI applications as they pertain to mental health. I think you'll see, we talked about AI maybe very generally as a system that takes in data, applies an algorithm, and then puts out some kind of output. And so all of that is important because each of those presents its own ethical concerns, right? From where did the data coming in, what data are you basing this on? What does the algorithm look like? How does that interpret this stuff? And then is the output right? Is it accurate? A lot of these things, at each point in those system are things that you have to think about. There are a lot of different applications of AI in mental health right now. I think you'll see maybe some more clinically focused applications of it. We mentioned Wobot. There's also things like Wysa or Therabot, AI chatbots, right? And that could be everything from clinically built and validated models that exist to provide patients, accurate information and maybe act as a sort of bridge between sessions to um, somebody with a good idea and some time can spin up an AI therapist with no background or whatever and make all kinds of crazy claims. So there's a wide variety of when it comes to clinical applications of AI. Um, You'll also see them now. I think a lot of you will be come across them, and probably the first way you'll come across AI is note taking, AI scribes. Right? Things that listen in and will write your note for you or accurately sum up the session. It's been used a lot on the medical side of things, right? So the doctor can spend more time facing the patient and less time kind of typing away and documenting things. We're starting to see it more and more now ourselves. I think you can have a lot of different reactions to that. I think, I've heard everything from people who run clinics tell me if I have a therapist and they can't write a note in 5 minutes, I don't want them working for me, to people who run very large organizations saying, wow, this is going to really help us maintain quality and assure that everybody is delivering quality care because I can't spot check. I've got 1,000 therapists working for me. I can't spot check everybody's chart in less than 2 years. So this is going to really help make sure that we're running effectively. There are other areas that you're going to see AI in terms of content, right? People using AI instead of Google search now for, asking questions, report writing. I mean, one of the first things I did with ChatGPT when it came out was take some of my old anonymized test data and drop it in and see what it can do. And boy, howdy, it wrote a pretty good report for me. And that was 2 years ago, and it's only gotten better since then. So I think love it or hate it is going to be a thing that is increasingly part of how we practice and part of our world. Um, and also, I don't want you to feel well, or maybe I want to normalize feeling overwhelmed when it comes to AI. I heard someone talk recently about how, and this was a person working in tech who works in the AI space, works with technology, works with software, and they said, I don't feel like I'm keeping up with AI. It feels like almost kind of like that Alice in Wonderland, that Red Queen's race where you're running faster and faster to just stay in the same space. So it is coming fast. The capabilities are coming faster than probably anything that we've seen. So it feels overwhelming because it is overwhelming. I'll say that. So really want to normalize that, not just for you all, but for people in the tech space too. The way things are moving is very, very quick. Oop, wrong button. Um, so let's talk. Remember, I said at the beginning, it's you thinking about AI as the data, the algorithms, and the output, right? And that kind of comes into play when we think about AI ethically and the questions we should have when somebody wants to use an AI tool, whether that's a patient or whether that's our clinic saying, hey, we want to use a new AI tool working with patients. We should feel comfortable asking these questions because or helping people to ask these questions because they're the kind of questions we should be asking. Where is the data? Where did you get the data that this trained it on? Was it representative of ethnicities, sexualities, conditions, all of these things? Is it, does the algorithm account for diverse populations and how they work and think? And can you make it explicable? I know that can be a challenge for AI, especially some of the early stuff is it can be a little bit of a black box, but to the extent that we can understand not only what the data that the AI or the algorithm is pulling from, but how did it make the decisions? What were the individual weights or calculations? There's some AI now that I think we'll see more in medical settings that has sort of its transparent sort of chain of reasoning. It's like it'll say like, okay, they're asking me this. I think they mean this. I'm going to look up everything on this condition. Okay, I found X, Y, and Z. I'm going to summarize it. here's the summary of X, Y, and Z, right? So working with systems like that can make us feel more comfortable, at least, of knowing where is it getting the data, what's it doing with the data, and how is it outputting that data. Vaile, can you think of any other examples while I take a quick sip?
In terms of where the data is trained, I think the other one is age, right? Because
Yeah.
what you don't want is the mismatch, right? The challenge is when you have an application where the data has been trained on one population and then you're trying to apply it to a totally different population. It is no longer representative of that population. And that's where you have these potential for negative outcomes, right? Because that's just not, it's bad data in is bad data out at the end
Yeah.
of the day. And of course, you know, the real challenge, I think, for a lot of developers is the majority of the data that they are pulling from is very homogeneous, right? And it is typically, you know, if it's internet data or if it's patient data, depending on the system that patient data is part of, you know, it's going to be reflective of who is being seen in that system. And in a lot of places, like say out in Stanford, I was just on a talk the other day, you know, when Stanford pulls data from its healthcare system, it's generally white, it's typically male, it's typically cisgender. And so, you know, how do you make those adjustments to mitigate, as you know, you see in the next bullet point, is how do you identify what those biases are and how do you mitigate them to the best the extent that you can as a developer?
And I think as a developer and for us as clinicians who are users and consumers of these sorts of tools, it's incumbent upon us to press them for this information, right? They don't want to do it, but what they want is your money and your time and your usage. Great. If you want that, you're going to have to give me more information about what data was this trained on. You're going to have to be more transparent about this, or I'm not going to put my time and effort or money behind this. We need to become more demanding consumers of some of this stuff, especially as it moves quickly, to make sure that we are doing this in a safe and ethical way. Um, because we talked about some of that algorithmic black box problem, right? We talked about the data that it could be based on could be biased. The black box problem, I talked a little bit about reasoning models that talked a little bit about, hey, um, i got I looked up, I found this data. So something in that Stanford example might be, I am pulling data across X number of patients from across Stanford's EHR. The patient demographic breakdown is X, Y, and Z. I maybe don't have a lot, like something where the model can tell you how it's thinking through and its own weights that it's applying to some of this stuff, can be helpful in ensuring that you are understanding this reasonably. Trying to think, I think some of the new ChatGPT model, if you want to see what this looks like, some of the new ChatGPT models do this. I think the DeepSeek model does this, where it'll go through and tell you kind of the chain of thought. I know of one that'll make its own to-do list, right? And let you know exactly kind of what it's doing as it's reasoning through these situations. It's tough, right? It's tough. A lot of that algorithmic things, I was talking with some graduate students, I was like, when it comes to building out some of these AI algorithms, there's a lot of vector math involved that there's a reason I became a psychologist, is because I don't want to have to deal with that much math. And there is a lot of math and technical complexity behind a lot of this stuff. And I think that goes to sort of our ethical responsibility of like, hey, I know a little bit about this. I know a lot about this. This is what I know. This is what I don't know about how this works, about where the data is from, about what the output says. I know that this tool is good or this tool is not. And again, goes to just like it's the same conversation I would have with people back when we first started using apps in treatment, right? It is that professional responsibility for, let me do my own investigation about how this is used, how this works, until I feel, again, professionally competent or comfortable in approaching some of these tools, or, even with patients, what is your comfort level? Not only for yourself, but for the patient, right? As some of these tools are more available to them. This is a fuzzy question. Remember, we were talking about a lot of ethical issues. We talk about fuzzy questions, and there is no necessarily hard and fast answer, which I know everyone loves when it comes to ethical decision making. Everyone's like, just tell me the answer. Tell me what I should do. Um, and this is one of those things where it's just not a good, we don't necessarily know what appropriate reliance on AI recommendations looks like, right? I think we have a sense of it, right? If I'm using one of those AI note takers, it's probably not, I know I shouldn't let it just write my entire note for me and click OK without at least reading it, right? You feel bad. I hope you feel bad if you do that. Um, but, do I look at it? Do I not? Like, do I change something? Do I not? Especially, I mean, what if it's really good, y'all? I mean, like, let's be honest, like sometimes AI can surprise you and come out, wow, that's a pretty clear, succinct thing, or give you things to think about that you maybe missed in treatment. You have to think about that. What is that appropriate reliance look like? Where does your clinical judgment come into play? And more importantly, what are the legal and ethical liabilities of these things as we move forward? Um, Again, I think we talked a little bit about it in chat of not only just what happens if you are overly reliant on AI, but what happens if your company mandates it, right? Like what happens if that becomes the standard of care is the AI note taker is more accurate at capturing anything? Could you be liable if you don't use an AI note taker in the future? Um, I know there are some companies looking at this right now. If they're doing large clinical audits, they can say, well, you use our tool or you might be more likely to be liable during our next chart review, right? Because I don't have say over the tools that you're using or those documentation practices allow me to be more, to get some of that data to be more sure that you're doing what you're saying you're doing. Um, in the end, I think it is, your ethical responsibility. It is your license on the line, right? If you're using some of these AI tools. I know I had a discussion with some graduate students, and this is the thing I reiterated to them recently was just, hey, I showed them, was like, here's what it can do. I'm not saying you should do any of this. I'm not saying that any of this is good or right. I want you to be aware of the things it can do so that you can start thinking about how do I use this? Or like on the research side, a discussion we had at APA when we came and talked about AI was, where is the line if you're doing things on the research side? On the one hand, I know having ChatGPT write the entire paper for me is bad, right? I shouldn't do that. Maybe if I need a little help on the coding side of things or to tweak something or, make a graphic, that's okay. Where's that line in the middle for you of goes from not okay to okay? So we know where the extremes are, and we're slowly kind of figuring out what that fuzzy middle looks like.
And it's not going to look the same for everybody, right? I mean, it really comes down to your own personal kind of risk analysis and what you're comfortable with in terms of, sort of incorporating some of these tools into your practice. Knowing, even if you've done your due diligence, right? And, you've tried to answer all these questions around transparency to the extent that you can in the privacy policy and the terms of service and the BAA, and you've, researched the company maybe a little bit and they've got good clinical leadership. Um, you can reasonably explain how the product works to a patient with, but you can't know everything, right? So, you do have to kind of decide at what point, does this work for you versus does it just not? Um, and I think that assessment is going to look different for different people at both in terms
Yeah.
of career stage, but also just, I think, probably overall technical competence, comfort.
Technical competence and just even the knowability, right? Of like, let's say you pressed me hard to explain how this Zoom call worked from a technological standpoint, right? I'm like, well, I have to think about where is it being, what kind of data is being stored and processed on my own computer, whether it's translating through the internet, and I don't know where that's going and what cloud computers on Amazon are on the back end and are those secure and right, like there are just limits to our ability to do this. And so you have to find what is that comfort threshold. Do you, as the kids say, does the company just give you the ick factor, right? Like, do you get the ick from the company, or do they actually have clinical people there who you can talk through these concerns and treat them seriously? I know there are some AI note companies now doing kind of like crosswalks of different security policies and saying this person will do this and that. And I think we need more of that, more of a kind of a group effort of disclosure for some of these things. Um, let's talk a little bit about the therapeutic relationship, right? The important part. How does it affect your patient to know that an AI might be taking notes? Are they comfortable with that? Are you documenting that in your informed consent? All of those sorts of things. Um, what is the client's perception of, again, we talked a little bit about comfort and technology moves throughout the age. They might be totally fine with it, right? There's some people who are going to not like it and not want it and not want to be recorded, and that's great. And there's some people who are going to be like, yes, please. Maybe give you a practical example of it. There is one company looking at taking AI notes and turning that into a podcast in between sessions that people can listen to. Um, I don't know if that's necessarily the right, feature or the thing to do, but I, as a clinician, love the idea of something for my patients to have in between sessions that is not a PDF handout or the thing that's been copied 500 times or just their own memory of what we said during session. I think that would be really great if the patient had something to refer back to or could even interact with between sessions to be able to say, hey, Dr. Cooper said you should do X, Y, and Z. How's that going? And then being able to review that before the session, be like, okay, cool, you did it. How was it? Let's talk about that. I love that idea of as a clinician, but does the patient, are they okay with that? Are you okay with that? Um, how do you maintain that human element in whether it's teletherapy, whether it's AI, whether it's using an app? How are you doing that? Which is interesting because I mean, there's even been some research. I know Wobot put out research that showed it might be possible to develop a therapeutic alliance with an AI, right? Like that's a thing to consider. And how do we consider that going forward? It's very easy for us to anthropomorphize things.
Well, I think you made an important point there, though. It's an empirical question at the end of the day, right? And that's, so similar to, is an AI chatbot, what's the impact on the therapeutic relationship? But, if we're talking about these AI scribes, right, what are their impact? Are they a third party? Are they seen as a third party observer? Are they, by the patient, are they seen as this is something really scary at start and then I completely forget about it? 10 minutes into my session because, I am, linked in with my therapist. So I think that ideally, going forward, we would have more research on the role that these new technologies are going to play as it relates to therapeutic relationship. I think some of the challenges, however, is maybe some of those things should have been thought of ahead of time, but of course they weren't, right? And so now we're having to catch up, and I'm hopeful that this is some of the stuff that researchers will be able to help us answer. Similarly within telehealth, we know telehealth works, but I would argue we still don't know exactly who it works best for, under what circumstances, and in what conditions. And so I think we need to hopefully, again, be asking these empirical questions so that we can feel more comfortable doing, incorporating some of these emerging technologies into our practice as tools, not as replacements, but as tools.
Exactly. Like, I think it'd be great if you got notes out of it and the client got notes out of it, right? Like, hey, here's the summary for you, here's the summary for the patient, those kind of things. And how do we, again, as we engage with these things, how do we advocate for more of these things that are beneficial to not only how we practice, but things our patients? How do we advocate for things that make us better clinicians and augment practice in the way that we want it to work, not the way that somebody else might want it to work? And again, that comes to engaging with some of these things and actually using it. That's honestly, that's when it comes to AI, it's trying to get psychologists to even try AI is sometimes the biggest challenge of just like, yeah, see what it can do, interact with it. Uh, all right, let's talk through some AI, AI case study, and I can't imagine this would ever happen, right? But let's talk through this. Um, if you're working in a hospital system, now we've configured the EMR to record sessions and generate summaries um, and of the sessions as part of the documentation process. And you have some concerns. You haven't really talked it through with patients. It's seemingly no psychologist or other mental health professionals were involved in implementation. Certainly that never happens with EMR or other tools, but now it's happening with this AI tool, right? Um, how would you, and you maybe see other therapists just accepting the notes kind of whole cloth. How would you maybe approach this with other therapists, with your supervisors? What would be maybe some of your concerns about this, or maybe even some of your concerns about AI in general? We can talk about those in the chat as well. Okay, someone's saying quality control. Maybe um, say more about that. Do you mean like quality control of the AI? Are they using it for quality control of therapists, right? Like, that's a possibility. Um, and I think it's good to talk with peer colleagues, but what kinds of things would you address? How would you maybe help somebody who's just doing the notes, just saying like, okay, like what would you want them to think through?
I really like Amy's response. I think that these are the critical components, right? We need training. There needs to be a policy, and you need to be able to opt out. I would argue is the third, that there has to be an opt out option as a provider, or at least as the patient, right?
Are we incorporating it in our informed consent? Like, cool, when is
Right.
this going out, right? When are we, um, you know, are we making people aware of all the risks of how this is being used? Um, what are the limitations of the tool, right? Like, is it going to be looking for risk, right, or not? Is it going to ping us automatically for some of these things or not? Um, well, where is the data going? Is it being used to train its own AI? Is it being anonymized? Is it being respected? Um, who owns the recording, right? Like, is it the company? Is it us? Who owns the data is a big one. Um, what are we doing from a legal perspective, maybe, right? Am I going to be liable for these notes going forward? Am I going to be liable if I don't use them? What is the overall policy of how we're going to be using these things or how we expect them to be used? What happens to the data after it's generated? Sometimes people store it and use it for training data. Sometimes it's just thrown away. There's a pretty big range when it comes to technological sophistication of some of these tools. Sometimes it's just transcription, right? I know there's a few that I use for note taking in meetings that just run locally on my computer. It does a recording, gives the transcription, and then immediately deletes it, right? The data is kind of thrown away. And it's just literally transcribing what happened. And then you can get things that are more sophisticated that are breaking out action items or doing other things or being stored in the clouds that you can constantly go back and review them and refresh them or have extra features. So how is this all interacting? How is it learning? How is it doing some of this stuff?
And I think it's challenging as a provider because in the AI mental health scribing space, we recently did an environmental scan and found over 45 different products, all claiming to, help you as a mental health provider, record your session and write your therapy and automatically generate your therapy note that then, again, you as the human should review and then can accept. And they all have different ways that they're doing it. So if you've seen one of these companies, you've seen one of these companies. They're really just sort of all over the place in terms of how they do the things that Dave just said, what they do with the data, where they store it, do they store it, et cetera. So it becomes really the responsibility of the provider or the system, depending on, what your situation is, to really vet these products to determine whether or not you would feel comfortable using them. And again, while I think they are, I understand why people feel somewhat scared by the notion of even recording and generating AI notes. I have talked with providers who have said things to me like, I met with this woman who had accessibility issues and wasn't able to type as quickly as she once had due to a physical disability. And so she was really able to, these were a huge time saver for her in terms of being able to, get notes done quickly, reduce burnout, reduce administrative burden, et cetera. And then I've heard of cases where, somebody was in a situation where they were using one of these AI scribes and they had a patient that was talking about, they had an African American, a Black patient talking about their cocaine use, and the AI scribe translated as crack, because it had engaged in, some racial biasing based off of the training data. So I think there to all of these, my take home is that there are goods and they're bad, right? Like this is not just we all have to make these determinations for ourselves on what we want to do and what we're comfortable with.
Exactly. And again, to underscore what somebody just put in the chat of, there are lots of gaps in knowledge and understanding about how it is applied. Yes, there are. Even for folks like me and Vaile, I think I would readily admit there are a lot of gaps in understanding of my own knowledge about how AI works. And yet, I know it is a thing that is getting used. I know that you will have patients using chat and AI and stuff between sessions. And I know that you will be asked to use AI note takers. And I know this stuff is coming. And so I don't want to necessarily be, standing athwart the progress of technology and saying, no, I want to kind of treat it in this kind of real format of like, well, this is how we think about these things. And this is how we act even on imperfect information, because we use our own ethical and reasoning and judgment to think through these things. Let's talk a little bit generally more about like apps and tools and things in general. I think we had at the beginning, there's those list of companies and different apps and tools in the space. We talked a little bit about the categories of mental health apps, and you're going to see things like Calm and Headspace and Talkspace, and all of these things come up. I'm sure you've probably had, much like telehealth, you've probably had some of these things come up in therapy before. And again, to reiterate, we're talking everything from digital health apps on the market that somebody can go download to maybe more specialized things. On the medical side, you have things like Up to Date that provide you, the latest evidence-based guidelines for things, or digital therapeutics, where maybe now you as a psychologist, as a social worker, are now asked to be prescribing something that will come with digital therapeutics. That's kind of a requirement. So navigating kind of these authority issues and how they kind of work. It's, again, you're probably might sound like old hat, but there's a lot of things to consider on any technology solution. That's much like the ethical frameworks are the same. The issues for a lot of technology solutions are the same, right? Who's collecting the data? Who's the company that's doing this, right? Just because they put a mental health app on the market does not mean they are a trusted and reliable person, that they are bound by HIPAA. Even if it seems like they are providing care, they may not be bound by laws and legal requirements, because they may not be qualified as a covered entity. are they transparent in their privacy policies? Most people are not, right? Most people, like, again, I am in technology and I am just like everybody else, that when the terms and conditions come up, I immediately just go accept, right? I shouldn't all the time. But I admit, like, I'm not going to sit there and read, if it's something personal for me, I'm not going to sit there and read the next hour on a lot of legalese and try to untangle stuff. Um, that's more important when we're talking about using it with patients and understanding that. And again, a place where I think we can be better advocates for demanding these sort of things, demanding for more readable terms of service. And do you have your privacy policy listed on your website? Is it readable? Is it understandable at a reading level that's applicable to all patients? Are helping them understand that our ethical guidelines is not maybe necessarily the way they do business in a VC-backed startup. I know I've reported on a couple of different startups to both the FDA and FTC for making claims where, hey, we have a CBT AI therapist and nobody at our company even has a psychology background. It's like, that's not cool. And we need to be better advocates for those kind of things. Um, Thankfully, again, I know DoD and VA and a lot of these folks are working hard to help you understand things about app privacy. I know because I helped write some of the ones for DoD about how to evaluate apps in treatment and work with them, things you have to look out. So I know those trainings exist and are important for you to seek out. Um, we also need to be savvy, not just on the tech and data side, but on the evidence base and effectiveness. And again, I know this is something that can lag behind the technological sophistication. There a lot of times there's marketing claims and then there's scientific evidence. And again, like I said in the beginning, I'm going to be using apps. We've been using apps for a while now. There must be some research on it, and there's not. And I think that can be a good thing or a bad thing. I know one of the issues that came up when I worked in the DoD was we had an app that performed really well in a pilot setting, and we wanted to put it out based on the pilot data, and had to have a discussion with the researchers to, they're like, oh, we want to do an RCT and we shouldn't put it out. And we're like, hey, there's no seemingly negative impact to this. It could potentially be beneficial. It could be life-saving in a number of cases. I think we're okay with putting this out without having a gold standard RCT behind it, because of the risks, because of the intervention. We had a long, lengthy discussion about what we should do in that, and be more evidence informed when it comes evidence informed development of some of these tools as opposed to evidence based. There are also a lot of the professional organizations have frameworks for evaluating app quality, and talking about this. I know there's a lot of material out there about, again, DoD and VA have their own guidelines and things for you to go and seek out that you can, use what kind of questions should I be asking about these kind of tools. Um, because quite frankly, a lot of these tools are made by people who are trying to make money. Like, I would love for every tool and technology that we use to be existing solely for the benefit of our patients and not have to make money. But especially outside of the DoD and VA, there needs to be a system to support this. Again, when I worked, that was one of the questions I had was, hey, great, there are all these coach apps from the VA. How does that work outside of here? Like, these are great, and I'm glad that the VA puts these out for free and makes them freely available. How does that work outside of here? Not, they can't do everything or treat every condition, a lot of these companies. And so understanding, do they have ads in it? How does that data work? Um, they want to engage with people and get, the whole thing of one of the things that tech companies try to do is get daily average users up. Like, I want them to be using this. A lot of our interventions maybe aren't designed for that, or are designed for people to eventually stop needing this, right? And that doesn't necessarily work with a commercial model of an app that's like, hey, I want you to keep coming back. Like, again, TikTok or something that I want you to come back as much and as often as you can. So understanding that tension and understanding how to have the discussion around that with a patient or with your colleagues about the tools that you use is important. Um, so yeah, let's talk through a quick case study on this. I think this can be applicable to a couple different things. There's two here. Um, Feel free to drop your answer in the chat if you're using maybe a mood tracking app to, log their mood or log some sort of, health related issue, but later, you discover it's sharing data with third parties for marketing purposes. I'm sure I could name names on that, but I won't. Um, there's also things like, you know, maybe they're using an app that you don't think is very good for them or conflicts with what you think the treatment goals are. How would you discuss that with the patient? How would you discuss the confusion or resistance that that brings up in treatment?
Well, while we're waiting for people to drop their thoughts in the chat, one of the things that I think about as, we continue to um, move towards more and more sophisticated technologies is in some ways, it's really just the evolution of things that we already had. So in this case, especially with the second one, I'm sure that individuals on the screen have had experiences where a patient has read a self-help book that maybe wasn't, very good. And now that self-help book has become an app, right? Like that's sort of how I think about it. And so you're always going to have, so sometimes I get asked, why can't you just tell clients to just not use these? And it's like, well, because people are going to seek stuff out. They're going to always go to Google. And now Google's become ChatGPT, right? To type in their feelings or what they're experiencing and have it spit back out. So I think, it's the next step of us having to be responsible professionals and navigating all this information and data that is coming in to patients and in this case, in the second one, possibly causing confusion and resistance. And so how do we think about not, in some way demonizing, right, the app, just like we maybe wouldn't with the self-help book example, but thinking about, how do I use this as data in my therapy session?
What are they getting from it? Like, what is the purpose of this? How are they doing that? And how can I incorporate some of that? Treating it as broken confidentiality for the first case study is a good example, right? Inadvertent disclosures of, okay, this is what, and I think, um, one somebody said in the chat, pointed out there is any inherent risk with any in form of technology and accepting that risk. There, and to kind of tie that back into the point Vaile just made, there's risk in going face to face, right? We have waiting rooms where people might see you and understanding, oh, hey, this is the behavioral health waiting room, and there is your friend over there, and you both know why you're there. Like, it's not like one of you is going to dental and the other is just hanging out waiting for a medical checkup, right? There are a lot of these issues of accepting risk and accepting how we do practice. And we try to minimize that. We can't eliminate it entirely. So how do we minimize it? And then how do we discuss it when, a risk and something has occurred? I like the idea again of Socratic questioning. I'm like, okay, what are you getting out of this? What is it doing it for you? How do you think this works between what we're talking about and what that's talking about? Should we change tactics? Should you go see somebody else? Right? Like that could be a thing who's maybe more in line with this. Maybe, hey, I'm not the most tech savvy. And if you want to be tracking all your data on Strava and, bring all this data in, like I'll try to keep up with it, but I can't say that I'm going to be the best at it. Good comments in the chat, I think, for all of this sort of stuff. Um, not becoming defensive, right? Like that's all good. So I think again, a good presentation will tell you once, will tell you twice, will tell you three times. Um, Developing an ethical decision making framework for technology is just like doing it for any other, for seeing clients in person. It's things that you've probably discussed, whether it's teletherapy or other areas. It's going to be the same kind of questions and dilemmas that we've been talking about today. You take that step by step approach. Um, you balance risk, you balance competing ethical principles, right? Autonomy. I want the patient to use whatever they want to use, but also I know maybe something isn't really clinically based. How do you kind of navigate that? How do you make sure that you're documenting whatever comes up as appropriately? And how do you make sure that you're doing your consultation and supervision, right? Some pretty standard things whenever it comes with any kind of technology, app, telehealth, AI. Make sure that you're working internally to create those policies and procedures. We've talked about it today of how does this factor in our informed consent? How does this change what we give patients and let them know? How do we make sure staff is trained on these tools? How is this going to be incorporated into the training program? What kinds of things are we going to change that we give out to our clients? Hey, let's take 5 minutes and think through if this goes wrong, what are we going to do? Right. I think we can all probably think of like some really basic scenarios. We've talked through some of them today in case studies, but I'm sure there's tons more that have come to mind that you can just kind of throw out and even just briefly discussing them, being aware, even if you don't have necessarily an answer, but hey, this is a possibility. Those kind of things are important. And yes, it is a challenge to stay current with evolving standards, especially when it comes to technology. And yes, I know clinicians don't need one more thing to do. You're already pulling so hard and doing so much, and so much is being thrown at you. It can be tough. But again, that is a thing that is important to put back on our associations, our supervisors, the organizations that we work for. Hey, I want to stay current with this. You help me stay current. I'm going to be taking care of patients. Collect some resources for me, like bring in somebody to do some training, help me make aware of what's out there, so that you can stay current with technology. And so that, again, they're also staying current. It's not just helping ourselves stay current, it's helping the organizations that we work for stay current and think through a lot of these issues that we've brought up today. There are going to be, a lot of challenges going forward. AI, again, I think I described it as sort of that Red Queen's race of moving faster and faster just to stay in the same spot. Um, you've seen curves that it's like this has been adopted faster than anything else in all of that we know of for technology, right? Like think about like the internet. It took better part of a decade for the internet to become a real thing, or email, or a lot of this stuff. um and then now ChatGPT is everywhere, and like side of nobody knew what it was 5 years ago, and now we're having these discussions about like what happens when my client is seeing me and has a ChatGPT therapist, or how do I navigate relationship issues with a virtual girlfriend? I don't know. Like, I don't think I would have thought myself I would be saying those things 5 years ago. So it is changing. And again, as Vaile said, the regulatory landscape is constantly changing, not just necessarily from this administration, but even before now. Like HIPAA was done in the 90s. Go ahead, Vaile.
Oh, no. Finish your thought and I can, or take a sip. Yeah. I mean, I think,
Yeah.
Not only that HIPAA was developed so long ago, but I mean, to be frank, even before this current administration, there wasn't a whole lot of movement towards any sort of federal regulatory policies specific to artificial intelligence. There were some blueprints and some things out there, but nothing was really there wasn't a lot of urgency, and with this administration, it's similar, and in fact, their approach is less regulatory, right, and more about being leaders and in the space. So what you're going to continue to see, and I think this is really critical for people to understand, is regulation at the state level. And so the challenge with that is that it creates a patchwork, right, of different types of regulatory standards that can span a wide spectrum, where you have some states that have proposed legislation around AI that maybe is too strict, is too restrictive. And then you have some legislation around AI that maybe isn't restrictive enough. So it really becomes incumbent upon us as professionals in this space to make sure that our state legislators are having the right people at the table to have these conversations. So it needs to be, those with an understanding of what are the potential implications if you offer a chatbot to every student for free in your school district. What does that look like? What are the potential opportunities and benefits? What are the possible unintended consequences that could happen? And those are the kinds of questions that I think individuals on the screen can help, state legislators, local legislations be able to answer, but we have to be at the table in order to be able to do it. And I think it's, again, as we think about what it looks like to be practicing interjurisdictionally, right? If one state has a particular AI policy and another state has a very different AI policy, what does that do for you as the provider if you're providing services in both states? So I think there's a lot more questions than there are answers, particularly as it relates to the regulatory landscape.
And we need you all to be surfacing these issues from what you see in practice and the questions that you deal with daily. APA, social work, ATA, both APAs, right? Like everybody needs to know more about these issues so that we can help tackle them and address them. I actually want to jump back for a second. I'm curious if any of you have examples of or know of for your clinics. You can drop it in chat. If you have examples of policies and procedures that your clinic has developed around technology, or I mean, even if it's telehealth or apps or AI, like, are you actually discussing some of these at the clinical level where you work? Have some of these issues cropped up before? How are you managing them? I'd love to hear more kind of about that. And maybe the resounding answer is no, right? Like that's important to know as well. Well, if it is no, I hope you can take some of what we've talked about today and bring it back to where you work to say like, hey, we need to address this. And let me give you some real concrete examples of how this is going to be effective. So yeah, if you have examples of how you and your group have thought through these things or not, I'd love for you to be able to drop it in chat and we can discuss them here at the end, or, maybe surface them. Because again, one of the biggest elements to all of this is us coming together as professionals, as therapists, to help each other address these issues so that nobody feels like they're all alone. And I think that can happen sometimes with a lot of these issues is you hear about something on TV or you read about something, you're like, oh my gosh, what is that? I don't even know where to start with that. I don't know how to address that. And it's only by, again, like Vaile said, for the advocacy side, or even just navigating these issues one-on-one, we come together to address this, right? And somebody just said they're very leery about they'll be ready to embrace technology in about 40 years. Maybe partly that can be a good thing, right? Like, again, I don't necessarily want, I like a little risk aversion on my medical side of things. I don't necessarily want them, hey, what is this? I don't know. It just came out yesterday. I'm going to use it on you, right? Like, we don't necessarily want to use that, but we want to figure out what's the balance for what we're ready to adopt ethically and sort of officially versus just, hey, what is going on out there? What is, going to be used on a regular basis? Let's say good policies around virtual care, managing suicidal patients. I think that's great. I think, thinking through some of these things too, not just virtual care, but like again, AI. Um, if we know we're going to do a suicidal patient, what if I have a suicidal patient who is now talking with an AI? Am I going to need to see those chats, or am I going to want to see those chats? Am I going to want to understand what they're talking about? Am I going to have that conversation? Um, are we going to want to use a tool in treatment to maybe help patients? Again, I can think about for those of you who work with settings where soldiers are going to be deployed, or maybe you work in a VA where you have a rural population who can only come into a clinic so often. What resources do we want to have that is going to go with them when they're outside the clinic? What technological resources? Not just Zoom. Could we think about an AI tool, and how do we vet that through as a group to help us do those sorts of things? Okay, let's wrap it all up and push for more Q&A at the end here, because again, I'm sure a lot of you have questions. Please start dropping them in the chat as I'm kind of wrapping it all up, and we'll get to it sort of at a Q&A at the end. Um, again, I think somebody said in the chat earlier, they're a little bit leery about the idea of, we've done this before. And, especially when it comes to AI, everything seems so new. It seems to be moving so fast. There's so many things to consider. Yeah, I think the answer to both is yes, right? I'm going to put on my hat as a therapist with my DBT training and it's a good dialectic. The answer is both things can be true at the same time, right? Um, Yes, it is moving faster than anything we've ever had to deal with. I think when it comes to technology and incorporating how we use this into treatment and all the number of things we need to think about. And I think it is equally true that we have a lot of good frameworks and a solid foundation to begin discussing and thinking through a lot of these things. Um, those core ethical principles those core ethical principles that we have of that help us navigate in-person care, have helped us navigate teletherapy, will help us navigate apps, will help us navigate AI. A lot of those core principles are not going to change regardless of the technology that comes on the scene, nor is our duty to stay current and to stay continuing educating ourselves about these things. Both of those things are part and parcel of what we do. We have CEs, we have all this continuing education, to constantly be learning and growing. It's none of us ever thought, well, I get out of grad school and I know everything I need to know, so I'm good and I never have to learn another thing ever again, right? No, we know there's always going to be something new, and I think the hope is that some of this will maybe make it less scary, even though it is quick and does feel like you're running downhill. I want it to be less scary for you by saying, like, though you have a lot of tools and things at your disposal to help you navigate this, you're not on your own. You have peers, you have ethical frameworks, you have professional organizations who are all here to help you navigate these sorts of things. You have CDP and the great resources of CDP for your specific populations to help navigate some of these things. All of these tools exist, and we're trying to help each other navigate these things as best that we can. Um, you really have, there is going to constantly be that tension of balancing innovation with protection, right? We want, again, I don't want you to necessarily be risky, but I don't want you to be 100% risk adverse. I want us to think about what is the good in these things and how could they be used to improve the way that we do care. Um, what is our professional responsibility in not only shaping ethical standards at the individual level, at our clinic level, at the local state level, at the national level? How can we all have a voice in how these things get conducted and are used ethically and responsibly, by having someone put in the chat, a radical acceptance that technology and AI is here to stay. So then how are we going to use this stuff in an ethical, responsible manner? And where do you go to get continuing education and dialogue? Vaile, any final thoughts from you?
Yeah, no, I just wanted to underscore that I think, and maybe we should have said this at the start, that we are operating under the principle, both Dave and I, that AI and other emerging technologies are here to stay. They are happening. They're going to continue to happen. And so if we can learn to radically accept that, then we can turn our attention away from fighting it to actually thinking about what are the possible avenues for ensuring that whatever emerges, particularly in the behavioral and mental health space, is safe, effective, responsible, and ethical, right? So, and I think that that is the responsibility of providers, not just as end users, although that certainly is what will be, but also what is our role throughout the development of different emerging technology products? What expertise do we bring to the table to help, again, create solutions that are effective tools to help people suffer less faster, right? I think at the end of the day, that's really what we all want. And so I think, everybody here on the screen are experts in behavioral change, and yet somehow we seem to have the most difficulty changing behavior. And again, I think for some good reasons, right? It's that balance, right, between innovation and protection. But if we're, again, thinking about the fact that, yes, because of the, influx of generative AI, all this seems like it's moving very, very quickly. But AI as a term was coined back in the 1950s. And we've all figured out ways to seamlessly integrate, maybe not generative AI, but other types of AI into our practices and into our lives even, right? I mean, if you email and you're using any sort of auto, you know, insert kind of language, you are using AI. If you are using Netflix and accepting their personalized recommendations for you, you are using AI. So I think while it may be too scary to start thinking about how might you use some of this stuff in your practice with your patients, maybe start with thinking about how you can integrate this in a more, intentional way in your life. I'll just give a very personal example. My husband, who's a little bit more into the AI stuff than I am, I mean, I'm still on my learning curve as well. He used ChatGPT to help track our golf scores for our golf game the other day. And ChatGPT not only could keep a score of our golf game, but was actually giving us tips on top of it. It was fascinating. So and encouragement, and noticed when I had a really good hole. So I just think that there are baby steps that happen in this space, to just like we would do with our clients, right? We wouldn't have them jump directly to whatever it is that they're afraid of doing. We create a hierarchical, stepwise sort of fashion in order to get them there. I think we need to be thinking about that for ourselves as well.
No, that's perfect. If it can only help you with your shanking, Vaile, I think it'd be good. I probably need help with my putting game. Well, let's move on to the fun part, Q&A, and I think we've got some questions in the chat already.
We do,
Good
and I absolutely loved Vale's example. Oh, sorry, David, were you going to jump to one?
No, go ahead. I was
Okay.
going to do Q&A. Go ahead, Jen.
Okay. Well, I was going to kind of actually reflect back on something that you said in the podcast that I thought was really insightful, which was, as a culture, as a behavioral health culture, we are not encouraged to play, right? Like, we're not encouraged to do something until we're very proficient and we're very masterful. Yeah. And I'm not insinuating that you play at the expense of your clients, but this idea that there are ways, like Vaile, you just mentioned one that was a great one, just in a personal way, for us to start to familiarize ourselves, see how it works, and do that. And so I just wanted to kind of repeat that here, because I think it kind of does go against our grain of our culture as behavioral health providers. Yeah. But that being said, I have a few questions that are kind of floating around from before in that. Yeah. And then there was one recent one as well. But way back when you were talking about the generational differences, Gen Z versus millennial, or did you have any thoughts about shifts in time and what that represents? And then maybe even more importantly, how does that inform where we need to be as providers as we meet the needs of these different generations that are coming up in the world and facing different types of problems?
Yeah, I think it is for me, the one of the ways I've approached technology when talking with clinicians is equating it to a form of cultural competence, right? It is the tools, beliefs, viewpoint that people view the world from. Um, I think with that slide, I think again, you can see people. There's a couple of things. It's sort of an inverse of they use technology as you kind of progress down the generations. They use technology more and are more distrustful, maybe, of clinicians and authority figure. And I think we can see that kind of writ large in society right now. I think again, things that we view of as technology are normal to them. I remember being baffled back in the day when a friend's 3-year-old who wasn't speaking yet picked up an iPad, opened up Netflix, navigated to what they wanted to watch, and started watching their own. I was just like, I took a second. I was like, that is so surprising to me that the child just did that, and that is going to be completely normal for that child going forward. They're not going to think a thing about that. And I think having that viewpoint of it may be new and curious and like why would anybody want to talk with an AI when they could talk with a real person? You have to be curious and open to like, okay, well tell me why and help me learn some of that stuff.
And are you good, Vaile? I didn't know if you had any thoughts. It's fine if you don't.
Yeah, I mean, I think when you look at that graphic, what you're seeing are Gen Z and millennials, using virtual care, tracking, using, health metrics digitally, engaging in wearables, but then not wanting to share that data with their providers, right? Which is really sort of interesting. And I think there is some emerging data that suggests that younger adults, so Gen Z, millennials, are concerned about the stigma that providers that if they approach providers with their mental health issues, they're worried about judgment and stigma, and that they're much more likely to engage with some digital tools, including these sort of anonymous kinds of chatbots, in order to discuss their mental and emotional well-being. And I do think that that is something that should give all of us pause. Like, why is it that they're feeling this way? What is it about seeking out healthcare services that that they feel like they cannot do? And that's really, I think, us needing to reflect back on what's happening there. And I don't have the answer, but I've seen this data consistently. And in fact, there's another survey that's going to be released actually tomorrow that reflects something very similar. So if you're interested, I'll try to mention it in my talk later.
Yeah, that's really interesting. And I think, across the board, just that curiosity, both of you brought that up in different ways. How do we be respectfully curious with our clients about these experiences that they've had or their hesitancy to share certain data in our normal non-judgmental stance. So that's great. There was just one about professionals. Will professional associations have sufficient influence to limit the influence of the free market? And I guess a tack onto that is earlier you talked about us showing up to the table, us bringing lessons learned from the clinics. And so I guess what are the best mechanisms to share lessons learned from the field with our governing bodies and maybe kind of both sides of that?
Sure. So I can certainly start. I think that the influence of professional associations, including the American Psychological Association, is somewhat limited, right? I have been asked, why don't you just go talk to Facebook and tell them to knock it off? And I'm like, Mark Zuckerberg doesn't care what I have to say. That doesn't mean we don't have other mechanisms. One of the things that we do is when there are technology products that want to advertise or exhibit with APA, we have a very intense vetting process. And if they don't meet it, we do provide them feedback with how they can improve their product. And oftentimes I'm finding that these companies are interested in improving their product so that they can get greater marketplace share. The other things that we have done is similar to what David mentioned, is we have gone to the FTC as well to raise our concerns about certain products in the space, particularly AI companion chatbots that purport themselves as therapists. And there have been some really poor outcomes. And I think between that and some lawsuits that might change the space as well. But I think at the end of the day, because I think the market will right size itself to a certain extent, where some of these products that just aren't very good are not going to get the uptick because it's so crowded. But we'll turn it over to Dave to see what he thinks, because he's a bit more in touch with the industry than I am.
No, I think based on what you just said, Vaile, like that's it, right? It's voting with our dollars, right? Like we vote with our voices, we raise your concerns, we advocate for it, and also vote with your dollars. Like don't use things or don't pay for things that don't have transparent, privacy summaries or things like that. Ask before you sign up for things. Well, how does this work? Who is liable for this note that goes in? If it's wrong, who's liable for that? And then how does that work? Ask the questions, make them uncomfortable. If you feel uncomfortable, make them uncomfortable about engaging with you, because that's, again, we know that that's part of the behavior change, right? Is going through that discomfort and having that conversation. So, that's what I tell anybody of like, just vote with your dollars and pay for the outcomes that you want to see, right? And give the attention and tell people when people ask about, oh, well, what tools do you recommend? Advocate the ones that are doing it right in your eyes and being able to say like, oh yeah, I like this and not this and have a reason why.
And if you're not like engaged with your professional association, please do, because we really do want to hear from boots on the ground, because that's where we know how to have an impact and where to really address your needs. And so, some of the ways that we do that at APA is through surveys, but we also just want to be contacted, to be honest, when you have problems. And I'm sure, NASW is similar, as is the other APA. So again, I think we can't know everything. That's why we set up committees and work groups, because we rely on your voices to really help us know what's happening in the pulse.
And I think one thought I've had frequently is, when we're learning a new EBP, so I'm learning CBTI or I'm learning PE. I, have the manual and I learn the skill and I'm, working with a client and I get consultation to really make sure that I'm moving forward in an ethical manner to, treat PTSD. What are the resources that are available to providers who have an ethical question or have kind of encountered a hiccup with something? Where do they turn? Because I feel like not everyone is knowledgeable, right? So are there some places you would recommend folks bookmark or have at the ready for not if, but when that happens, when they have that ethical situation pop up for them?
I think obviously APA and their state associations, things like that. I know when I was working in DoD and VA, there were Office of Connected Care on the VA side, DHA on the DoD side, would have resources and reaching out to those organizations to find out what they have that's not on their website, right? That was always important. I couldn't put every resource that I had available out there, but anybody would contact me and I'd be like, oh, yes, let's have a call or let me talk through some of these issues with you. Or here is the training manual that we just put out. Reaching out to those local groups, beyond of what you can find on the web and asking them for resources, I think is important. Professionally, there are organizations, Therapists and Tech that I belong to. Society for Digital Mental Health is another I can think of on the research side, that are both nonprofit, nonpartisan biased groups trying to tackle whether it's, sort of the how do you do these things on the Therapists and Tech side, how do you research these things on Society for Digital Mental Health side. There are conferences around these things, standing up, not just ATA. There's ISRI, there's going digital behavioral health. There's all these kind of avenues for folks to get involved with. Vaile?
And of course, your liability insurer as well is always be thought of as a resource in the space. Because if they're not on the pulse yet, they will be. They need to be. So.
with the key, I think, be at have those numbers available. Don't be searching and scrambling to find that stuff, but make sure, you have those supports in place. My husband is actually flying home from ATA today, David. That'll be no surprise to you. So, there is a fun question. We'll take a fun one. What is your, no, I can't find it. What is your favorite use of AI, clinical or non-clinical, something like that. But yeah, what AI tool are you most excited about right now? And it can be clinical or non-clinical.
I won't necessarily name the specific company to endorse anything, but I think there are companies out there who are using AI in a really interesting way that I think would make me a better clinician, right? It is taking all that notes data and then giving me immediate post-session supervision. Hey, you talked this much, like, did you address X, Y, and Z? Or the patient mentioned, this issue, but you didn't discuss it in session. Did you notice that? Or, maybe bring that up next time. Things that, normally you have to wait on supervision. Oh, I got to wait a couple weeks and I got to remember what I said. But like having sort of that reflective, almost assistant to you that you can ask and then be like, hey, did I also like look back through my notes? Did we talk about that before? Where was the last time we discussed that? Things that, again, if I had my notes on a notepad, could I sit down and kind of go through them and like look at this for like hours on end? Sure. Am I going to? No. But like having a tool that helps do that for me, I think is what is example of how this technology will help us be better clinicians and have better outcomes for our patients.
Yeah, and similarly, I don't want to plug a particular product. For APA has a policy for its staff on which products we can use and which ones we can't. So professionally, I have access to one AI product currently, I've had it help me create slides. I had it punch up my bio, which is not the bio that Jenna read, but is a different bio because I'm almost too embarrassed because it sounds almost too good. And I think that's the other thing with AI that's really interesting that I hear from people. They feel like they're cheating when they use it. They feel like they're not actually, using their brains in some particular way. But I think that's just another one of those barriers we have to overcome. But the point I'm trying to make is that the AI tool that APA allows us to use isn't actually all that good. And you only know that by playing around with the other tools. So I wouldn't suggest one particular tool, but I would seek out a bunch of different ones, play with them and decide which ones work for you under what circumstances. I have a colleague who has like 5 of them open at all times, he says, and uses them for different purposes. So it's amazing the difference between the different even just GPTs out there. And so again, I just encourage to play around.
And I think another thing too is, use them to learn how to use them, right? Like having that discussion, hey, how do I get better at this? Or all the time I'll say like, hey, I want you to do X. Help me come up with a way to tell you how to do X that's going to accomplish what I want. And I think part of the question also, Jen, that just came to mind was like, what's the most creative way of using AI that I've seen? I helped my uncle is still practicing, even though he's retired on the medical side. And so he volunteers a lot with, populations that often don't get a lot of care. So it was, hey, I need to explain this medical concept to this patient who speaks another language and also probably has a 4th grade reading level. So I said, what do you want it to say? And I went through ChatGPT. I was like, translate this into, I think it was Somali at, this kind of educational level. I told him, I'm like, is this going to be perfect? No. Do I know if it's going to be 100% accurate? Nope. I don't speak Somali. Do I have a good, assurance that it's going to get the gist across? Yeah. And so again, measuring from the floor, like what would be perfect would be if I could get a Somali translator who spoke this thing, and like, that would be perfect. I wish we had that. But sometimes you go to war with the tools you got. And so where this patient might not have gotten any education that they could understand in their native language. Now we were able to at least offer some guidance that we knew was evidence-based because my uncle, the doctor, told me how to do it. Great. This is exactly what you wanted to say. Great. Here we go. And, it gave us our best guess.
That's a great example. And I again, I know I come back to PE a lot, but I think sometimes one of the questions we get in consultation is like struggles with in vivo hierarchy items for a certain type of traumatic event. And when you're kind of stuck in that brainstorming, that like there's so many examples of that where you could be like, what would be some great examples of nuances of this type of exposure, right? And you're taking that and you're incorporating it into your treatment plan, into the treatment you're providing in a very informed way. Yeah, so I want to just give a huge round of applause to both Dr. Cooper and Dr. Wright for a very engaging, informative. I will be thinking about some of the things that we talked about for a while, and all the energy you all brought with your questions and comments to the chat. We really appreciate that.